Ladies and gentlemen, today I want to illustrate a situation for all of you. A common situation I'm sure many of you heard about, but an intriguing one, nevertheless. Now I want you to really imagine yourself there, so bear with me. Imagine you're standing by a railway track and you see a trolley hurtling towards 5 people who are tied to the track. You're standing right next to a lever that has the power to divert the trolley onto a different track where only one person is tied up. Now really think about it for a second. What would you do? Is it ethical to sacrifice one person's life to save 5 others? Is it ethical to actively intervene in a situation where you are not directly involved in? Now, just for a show of hands, I want to see everyone that said the track with only one person. No shame here, I promise, just want to see general consensus. Now, I'm going to make one small change. What if that one person was a family member, someone you were close to, or a close friend? Does that change your answer? This is the well-known ethical situation of the trolley problem. And these situations are not too different from what many healthcare professionals encounter in the healthcare field. The possibility of human cloning, the use of fetal tissue in the treatment of diseases, and the legalization of physician-assisted suicide are all scenarios which raise questions about the ethical implications of future healthcare scenarios. But before I dive into the complexities of healthcare ethics, I want to start by asking all of you a question. What do you think of when you hear the word ethics? Do you think of honesty, integrity, or perhaps morality? Or do you think what will cause the greatest good for society as a whole? The topic of medical ethics is definitely not new and has changed drastically over the years. I mean, it certainly has to have changed since this picture of me as a child. Yup, there you have it, a picture of 6-year-old me, full of life, don't know where that went, and motivated to become a future healthcare professional. Admittedly, it may have been because of me binge-watching Grey's Anatomy, but that is besides the point. But although the picture is funny to some, there's a key distinction that must be made. In this very short period of 10 years, there have been countless medical developments, such as robots performing their own surgeries, the use of AI in decision-making, and the automation of telehealth. And as we can see, we must adapt our ethical principles to meet these new challenges. In healthcare, there are many ethical dilemmas that are not easy to resolve. For example, is it ethical to withhold treatment from a patient if the treatment is very expensive and the patient's likelihood of survival is low? Is it ethical to use medical marijuana where it is not legalized? These are all difficult questions, and there are no clear-cut answers. The importance of medical ethics is well stressed by Potter Stewart, who says that ethics is knowing the difference between what you have a right to do and what is right to do. And according to Professor Raza, the 4 main ethical principles that guide healthcare professionals in their journey is autonomy, beneficence, non-maleficence, and justice. Autonomy refers to the principle of respecting a patient's right to make decisions about their own healthcare. This means that healthcare professionals must ensure that patients are fully informed about their treatment options and that they're able to make decisions based on their own values and preferences. Beneficence refers to the principle of acting in the best interests of patients. This means that healthcare professionals must do everything that they can to promote the health and well-being of their patients. Non-maleficence refers to the principle of avoiding harm to patients. This means that healthcare professionals must ensure that the actions do not cause harm to patients, and that they take steps to prevent harm wherever possible. And finally, justice refers to the principle of fairness in healthcare. This means that healthcare resources should be distributed fairly, and that patients should be treated equally regardless of their social status, race, or gender. So how can we apply these principles to navigate the ethical dilemmas of tomorrow? One example is the issue of healthcare rationing. As healthcare costs continue to rise around the world, healthcare systems are faced with the difficult decision of how to allocate sparse resources. One approach to healthcare rationing is to use the system of priority setting, where healthcare resources are allocated based on a set of criteria. For example, resources may be allocated based on the urgency of patient's need, the potential benefits of treatment, and the cost-effectiveness of treatment. However, this approach raises ethical questions around the principle of justice. How can we ensure that healthcare resources are fairly distributed and not discriminated based on age, race, social status, or gender? Another common scenario that we see all too common is organ donation. Organs can be taken either from dead or living donors. Usually the donor is a young, healthy, and hardy person who was injured or killed violently, and then a kidney or liver is removed from them whose brain is dead, but the heart is still working. That's a key distinction to make. The brain is dead, but the heart is still working. This scenario raises several ethical as well as religious questions, including gaining consent as well as various methods of determining brain death in different groups of people. The belief of brain death is now acknowledged by a majority of people, but the view is not universally accepted. For example, many of the Orthodox Jewish community believe that death occurs due to the heart malfunctioning rather than the brain, and some parts of Asia believe that brain death is not even a phenomenon. In addition, the kidney remains transplantable for only 1 hour after the heart stops beating. This then lies an ethical issue. How can we get a family member's consent in such a short period of time while they're going through so much grief? This scenario also raises questions around the ethical principles of justice. Should we prioritize the patient's religious beliefs over their right to life? Should we consider the potential impact to other patients who may need the organ? And finally, another ethical dilemma in healthcare is the use of new medical technologies, such as gene editing and artificial intelligence. While these technologies definitely hold great promise for improving healthcare outcomes, they also raise ethical questions around the principles of autonomy, beneficence, and non-maleficence. For example, gene editing could be used to treat genetic diseases, but it also raises questions about the ethics of altering the human genome. Similarly, artificial intelligence could be used to improve diagnosis and treatment, but raises questions on the impact of bias and ethics of using different algorithms to make decisions about patient care. As we can see by these 3 questions and these 3 situations, there are no clear-cut solutions to each dilemma. To address ethical dilemmas, it is important that we involve patients and the public in the discussion about the use of new medical technologies. This can help to ensure that the potential benefits as well as the risks of these technologies are fully understood and that they're used in a way that is consistent with ethical principles. By discussing these issues and considering different perspectives, we can gain a better understanding of the ethical considerations that arise in healthcare and how we can navigate tomorrow's moral dilemmas. By following the principles of autonomy, beneficence, non-maleficence, and justice, we can ensure that we are acting in the best interests of patients as well as the healthcare industry as a whole, and that we can navigate ethical dilemmas in a way that is consistent with our values and beliefs. So the next time you see a very glamorized version of the hospital industry, most likely because of this individual to the right, just know that decisions made by the physicians are not without careful consideration, and they do not happen in a split second. The healthcare landscape will continue to evolve rapidly, and in order to solve tomorrow's questions, we must look at today's answers. Thank you.